HRCT chest. Clinical info. COVID positive 20 days back. Technique. 1.0 mm reconstructed images from a scan performed on multi-slice CT reviewed on workstation using different window and level settings. Non-contrast HRCT scan is performed. Findings. There are multiple bilateral variable-sized dense ground glass nodules, with associated interlobular septal thickening and bronchovascular prominence. Findings are predominantly seen in lower lobes. No segmental collapse, pleural effusion or pneumothorax is seen. Following lung segments are involved. Right upper lobe. Apical segment has no involvement equals 00 score. Anterior segment less than 50% involvement equals 01 score. Posterior segment less than 50% involvement equals 01 score. Right middle lobe. Lateral segment less than 50% involvement equals 01 score. Medial segment less than 50% involvement equals 01 score. Right lower lobe. Superior segment less than 50% involvement equals 01 score. Anterior segment has no involvement equals 00 score. Lateral basal segment has no involvement equals 00 score. Medial basal segment has no involvement equals 00 score. Posterior basal segment less than 50% involvement equals 01 score. Left upper lobe. Apical segment has no involvement equals 00 score. Anterior segment has no involvement equals 00 score. Posterior segment less than 50% involvement equals 01 score. Superior lingular segment less than 50% involvement equals 01 score. Inferior lingular segment less than 50% involvement equals 01 score. Left lower lobe. Superior segment less than 50% involvement equals 01 score. Anterior segment has no involvement equals 00 score. Lateral basal segment has no involvement equals 00 score. Medial basal segment less than 50% involvement equals 01 score. Posterior basal segment less than 50% involvement equals 01 score. Thyroid is normal. There is no definite mediastinal, axillary or supraclavicular lymphadenopathy. Heart, great mediastinal vessels, esophagus and tracheobronchial tree do not show any abnormality. There is no pericardial effusion. GE junction is collapsed. In visualized upper abdomen, mild bilateral paranephric fat stranding is noted. Rest of visualized upper abdominal viscera and bowel loops do not show any abnormality within the confines of non-contrast examination. Minimal, early degenerative changes are seen in visualized spine. There is no aggressive osseous lesion. Impression. Multifocal bilateral variable-sized dense ground glass nodules, with associated interlobular septal thickening and bronchovascular prominence, predominantly seen in lower lobes. Findings are consistent with COVID-19 pneumonia, CORADS5, with CT severity index of 10/40. Severe corresponds to more than 19.5/40.